Welcome to a new edition of South Sound Business Report. Today highlighting healthcare champions. Stay tuned. Thank you for joining us today, and thank you also to Puget Sound Energy for its continuing sponsorship of this weekly television look at business in the local area. The provision of quality health care to our neighbors and residents in the South Sound region is a significant portion of the local economy, second in numbers only to state government employment in the capital city area and military personnel assigned to Joint Base Lewis McChord in Tacoma and Pierce County markets. Today's program will be bringing you video highlights of healthcare champions, significant practices and individuals recognized over the last few weeks by the Business Examiner and the local medical community. Our co-host Holly Smith-Peterson has vignettes on each of the honorees.
The Business Examiner Media Group created the Healthcare Champions Award several years ago for both Tacoma, South Pierce County and Thurston, Mason County. Today we share with you our remarkable honorees, starting with the longtime pediatrician who's our Lifetime Achievement recipient.
So my name is Charlie Keck, and I came to Olympia in 1972 and came to Olympia in order to work for Group Health. And I've always enjoyed pediatrics, and when I was in medical school, I got a summer scholarship to work in public health, and that kind of turned me on to the idea.
Megan Hubbard. I'm a pediatrician and have been a partner of Charlie Keck's for many years. I've known Dr. Keck since I came here in '86. When I first started working for Group Health, he was my partner and had been my partner until the time he retired.
Hi, I'm Cole Mason. I'm a pediatrician, now mostly retired, here in the Olympia area. I've known Charlie for about, oh gosh, since we came here in 1975. Well, he's been a pediatrician both within the Group Health system, but also as a role model for the rest of the pediatricians. He's certainly shown us in a gentle way how to get along better, had demonstrated that both with his colleagues, and I count myself lucky as being one of them, but also with his patients. He's been well respected in the community, both in the hospital, but also within the Group Health system.
I'm Bill Newmann. I'm here in Olympia the last 30 years, and I've been a family doc working mainly at Group Health. I worked with Dr. Keck in primary care, and through till the time when he retired. He was here before I arrived, so I'm not quite sure how long he's been in the community. But I've worked with him in that capacity, also in capacity as a fellow volunteer in some of the efforts that he's made in the community since I've known him.
Charlie's been very involved in the community care clinic. When I first came to Olympia, the community care clinic was in a trailer outside on the property at St. Peter's Hospital where we're standing now. And I know he and several other partners from Group Health were very involved, instrumental in setting that clinic up, and it served for many years for a very underserved population.
When Rick Bird, who was the principal of one of the local elementary schools, called me about his concern about the Vietnamese students who were losing their Medicare, I assembled a group of citizens, professional and lay, who helped me set up a free clinic at St. Peter's Hospital.
He also has remained active in the community. He works, does some volunteer work where I do also with the Thurston County.
Most volunteer activities, there's a real sense of kind of accomplishment and something for the common good that's involved. Sometimes when you've been in your own clinic all day and you're tired and then it's your night to work in the free clinic, you sort of drag in and you come out feeling elated because A, you've done some good, and B, you're with a bunch of other enthusiastic people, and also you see a clientele that's not only medically interesting but very grateful to have gotten some care.
Our other distinguished service recipient came to the Tacoma area about 14 years ago and has since become one of the major breast cancer treatment and information resources for the area, for both patients and providers.
On a daily basis, we usually see somewhere between 20 and 30 patients in the office. I'm here in the office twice a week, all day long, and then I'm operating about 3 days a week. It's very overwhelming when a woman is diagnosed with breast cancer, because there are so many choices. First, they're trying to deal with the fact that they have cancer, and then they have to make choices as to what type of surgery they're going to have, whether they're going to try to save their breast or have their entire breast removed. I'm just a person treating them. I'm not some doctor on a pedestal talking down to them, but I'm at their level, and I realize that they are important, their time is important, and so I try to respect that. Many people think that you have to have a family history of breast cancer, but in my practice, the average age that I'm diagnosing are women in about the ages of 45 to 48, and many of them are raising small children, and it's a very frightful experience, but we help get them through it, and they just are so appreciative of what I've done for them. So I feel like it's just become my life. They know that they might get a phone call from me at 9:30 at night, because I want them to get the answers as soon as possible. I would love to say we would find a cure to breast cancer and put me out of business, and that would be okay. With my own role, I want to just keep educating women so that they can get diagnosed early, they can get the appropriate screening. The women that are at risk for breast cancer because of their family history, that we get to them early, get them into an appropriate screening program so that we can help either to prevent their breast cancer or we can get it at its earliest stage. I believe in being with them on their journey, and I think not only treating it and diagnosing it correctly is important, but when I finish surgery, I don't say goodbye to my patients. It's like, okay, what else can we do?
The attitude of what else can we do is evident throughout all of this year's Healthcare Champions. In fact, it's the reason for the creation of the RotaCare Free Clinic in Tacoma.
The way that we deliver healthcare in this country is usually through insurance. So folks without insurance have a barrier that is very difficult for them to cross over without assistance.
Our patients are so happy to be here because they have not been receiving care. I've been a nurse for 58 years, and I have worked in numerous venues. This is the happiest place, honestly. Everybody is happy and lovely and kind, and you know, it's not like going to a stiff office.
We have a fabulous medical staff with a medical director, but it's the nurses that greet the patients, it's the nurses that do the discharge.
The people who are here are amazing, and it's just as though they dropped out of the sky, this amazing group of doctors and nurses.
The mission of RotaCare is to deliver excellent medical care to folks who are chronically ill but have no access to the clinics, to medical clinics.
There's one young man that I can think of who was so ill and close to death. He's got a job, he's lost 150 pounds, his blood sugar is normal, his hemoglobin A1C dropped 4 points, which is unheard of. That's the kind of thing that there's a future.
We had one family who we kept until he was eligible for Medicare. He came back, he said he had never received such good medical care in his entire life. He gave us a check for $500. And this was a family who scrimped to take their grandchildren to a movie maybe every other month.
I would love to see it end, because my hope and my prayer for healthcare is that we all are afforded health care, that, you know, that there's a possibility that maybe this wouldn't have to be anymore.
I never asked to be the voice of the uninsured, but who is? Who's out there talking on behalf of the uninsured? And when our patients ask me, why do you do this? I say, because we're all in this together. We are. We're all in it together.
We'll be back in a moment to share more of our Healthcare Champions. But first, this message from our sponsor, Puget Sound Energy.
For more than 12 years, Providence St. Peter Hospital has been partnering with PSE's Energy Efficiency Program. As a result, in the past year, we've been able to save over $700,000 on our utility bill.
What PSE is doing by investing in renewable energy and wind farms is really an investment in the future.
We're in the community and on call for our customers day or night.
PSE is working hard to provide me and my family with dependable service. interested in helping the patients meet them where they're at, what their goals are, and then help them restore that function. They'll say, for instance, I want to be able to wrestle with my kids, or I want to be able to play baseball again, or I want to be able to hike in the mountains again.
I went from being on some heavy meds to where I'm down to taking barely any pain meds anymore.
It was a gunshot wound received in combat in Iraq, and was just having chronic pain from it. It tore a lot of muscle, bone, stuff that can't be replaced but still aches a lot.
I was very guarded going to the driving range for the first time just to take that first swing. I ended up hitting 140 balls the first time I went to the driving range just because I felt so good knowing that I could do it without hurting myself. The first time I seen the chiropractor, I walked out of there and I felt like a brand new man. I was like, okay. I was even dancing in the hallways. It was funny.
I saw amazing progress that I thought I was beyond. All the way down to the simplest thing, like being able to tie my shoes with one hand, you know? So that was something I gave up. I'd buy them, tied up, and leave them tied up. I would never untie my shoes because I couldn't tie them back.
I think we all recognize the value that each of us brings to the table, and I think our patients help us to understand that. You know, our patients often will talk about how important every segment of the program was.
I brought my wife in day one. They introduced themselves to her, told her you know, everything that they were going to try to do to me in the next 6 weeks. Told her that she can come back anytime she wanted to. So I mean, very friendly, very family oriented, and then the people themselves are just, you know, great people to be around.
And it's very rewarding and you know, professionally satisfying to work together as a team. You know, we just had our weekly team meeting where we discuss each of the patients who are enrolled in our 6-week functional restoration program. And with each patient, we ask each member of the team, you know, how are they doing this week? And
it's not just you go to one doctor and then you go to another doctor. These doctors actually communicate with each other and let you know, okay, this is what I want to do, this is what I want to do, combined, and it's just awesome. Everybody here was just so friendly. Even like having some depression issues, coming in here, having a bad day, the second you walk in here, everybody was just made you smile, no matter what kind of day you had. I always look forward to coming here, always.
Innovative Community Service is the category for our next honoree, Mr. John Masterson, CEO of Behavioral Health Services.
My name is John Masterson. I'm the CEO of Behavioral Health Resources here in Olympia, Washington. So as the Chief Executive Officer, I'm responsible for all of the operations and functions of BHR, as we call it. BHR provides psychiatric therapy and community support services to people across 3 counties, Thurston, Mason, Grays Harbor. These individuals are suffering with mental illness and or substance abuse issues, often both of them. And while these are not curable conditions, they are treatable, and we help them recover from their disease and live healthy, productive lives.
My name's Doug Ma. I served on the board of directors at Behavioral Health Resources when BHR hired John Masterson. John is very innovative in the sense that he is able to identify both opportunities and needs and then bring the materials together and the people together to make it work for our community.
There are a number of things that we are currently working on or have worked on recently. We are expanding the campus that we're on today, and our intent is to add primary care onto this campus to meet the needs of our clients and to consolidate our Olympia area offices onto this campus so it becomes a one-stop shop for our clients. We also provide housing. We have about 70 housing units that we offer across 3 counties to people who otherwise would be homeless on the streets. And in those housing projects, they're able to receive their mental health services on site. We also are in the throes of implementing electronic health record. We're excited about that. It should be live later in this year. And that will not only assist our own staff in providing care to our clients, but will assist places like emergency rooms through the health information exchange in the state to have access to needed information should our clients show up at an emergency room.
John has been very innovative in diversifying the services and the revenue streams necessary to keep Behavioral Health Resources a viable organization. That ability to find new services, create new services, bring about new opportunities to provide care to those most in need in our community is a tremendous asset for Olympia and the greater Thurston County region.
Healthcare provision encompasses many varied forms, whether it's the mental health area occupied by Olympia-based BHR or the Outpatient Oncology Clinic at St. Francis Hospital in Federal Way.
The first thing that happens when they walk through that door for the first time is they see the huge smiles on the faces of the two girls at the front desk. That immediately puts them at ease. They're welcomed, offered coffee, water, juice, whatever. Give them a breakfast menu if they're going to be here all day so they can order their breakfast.
We're following our patients through their journey of their treatment and beyond that. So to show that, you know, you truly care.
There is a lot of laughter. If you do not have a sense of humor, you cannot work in this department because the patients come in, they laugh, we laugh, and our chemo patients will leave saying, "Oh my gosh, I know I was getting chemotherapy, but I actually had a lot of fun. I'll see you again next week."
I think they get to know us on a personal level, and we become an advocate for them. And then they can count on us and know that when they're in need or if they have questions or concerns that they can turn to any one of us because all of us work together as a team.
I don't care how busy we are, we have time to stop and visit and say, "Hi, how you doing?"
Oh, they just seem to be, I mean, the patients and their families are so relieved that they have us as a backup for any time, you know, when they need to call. Oftentimes it'll be in the, you know, late night.
We have patients that have been coming here for 17 years that we know very well. I mean, we're seeing them every 3 weeks, we might see them every 2 weeks, might be once a month, but in those years you develop such a rapport, you know their children, their grandchildren.
We just have an excellent team. We're more like a family than actually co-workers. We spend most of our time, probably more time here with each other than we do at home. And we can finish each other's sentences. Franciscan way is we're there for the patients and we want them to have the best experience that they possibly can.
The South Sound also enjoys an enormous asset in Joint Base Lewis McChord, which has more than 250,000 soldiers and retirees, not to mention tens of thousands of family members and civilian workers. JBLM also hosts one of the military's premier medical facilities at Madigan Army Medical Center, with an ER department that's also a healthcare champion.
Our emergency medicine residency program consistently scores in the top 5 programs in the country on their annual board exams.
I think you have to have a lot of internal drive to make it in this residency. It's not an easy residency to get into in the first place, and so we start off with usually pretty good substrate. But after that, it's 3 long years, working nights, working weekends. We've got 33 residents. Of those, 2/3, 22 of them were above the 90th percentile in the nation. That's top 10% in the nation for 22 of our 33 residents.
And we've also, it's been great to work with Dr. Jacoby and the whole trauma trust group, and I think we've established a great partnership and probably a model for civilian military partnerships in hospitals and trauma care.
Trauma is not expected. You know, nobody expects to be in a motor vehicle accident. Nobody expects to fall. So it's very important that we have caring and compassionate people.
You know, we've also instituted not only the medical side of the care, but we've started having social workers involved in our trauma care, having routine alcohol and substance counseling. So we've really tried to address the whole person and all of the issues that play into why they had their trauma. Not just that they crashed their car, but why did they crash their car?
We care about what we do. We always try to provide the highest quality of trauma care available for all of our beneficiaries, whether they be civilian, military, and the caring is the major part.
The next honoree receiving the Healthcare Safety Net Award is Dr. Greg Blackner, introduced here by some of his colleagues.
Hi, I'm Greg Blackner, family doctor here in Olympia, Washington.
been in practice for about 22 years. I've always done pediatrics and cared from the family from birth till adulthood, even geriatric age.
I'm Deborah Johnson. I'm an OBGYN physician and I work at Capital Medical Center. I'm also the chief of staff there. We have a lot of mutual patients and they are very grateful to have him as their physician. And I think that that is a huge testament to his abilities and just him as a person.
While all of the primary care doctors in our community are exceptional, he is a quiet leader among them and is often the first to step forward to meet unmet community needs.
Over the years, I've tried to be a good example, tried to take good care of my patients, be there for them. I've done several years of scout physicals, sports physicals, free clinics to help some of the underserved get the necessary physical needed to take care of.
He does the sports physicals for the kids. He does physicals for the missionaries.
Most recently, we've been involved in the Project Access to try to help patients get care who have no resources.
He is very invested in his patients and he goes the extra mile. And he just does it every day. He's just present every day. And I think that that is worthy of recognition.
And the judging panel agreed. Now we have one more healthcare champion to introduce, and he's not a provider or a direct caregiver. Jonathan Seib does stand out, however, as someone who cares deeply and deeply impacts health policy for all of us.
I'm Cathy Wolfe, Thurston County Commissioner, and I have heard Jonathan Seib described as one of the sharpest, most innovative, most intelligent, most creative healthcare policy thinkers in the entire state. Jonathan is a real big picture thinker. He deals at the state level, but he also knows how to bring that policy down to the local level.
I'm Jonathan Seib, Executive Policy Advisor in Governor Gregoire's Executive Policy Office. One of the fringe benefits of the state capital being here, Olympia, is probably the responsibility, I would almost say, on the local community to be amongst the leaders in terms of engaging with and providing comment on, sometimes being the guinea pig, if you will, for innovative healthcare ideas. I think one of the innovations we have tried to integrate in much of what we've done reflects this notion that in the end healthcare reform is very community-based activity, that healthcare is very community-based activity, that it can benefit from the relationships that exist within a community and build and grow on those.
Just to talk to him, you understand his depth of knowledge and his commitment to healthcare quality, healthcare access, healthcare cost issues, and all of the other associated issues. He understands it not only at the system level and at the policy level, but at the heart.
I appreciate the recognition. I don't know that there's any of us who do this for the recognition it brings. There's so much work yet to do that there's also part of me that wants to insist that no one is yet deserving of recognition. We still have too many people who are uninsured and too many people who don't have access to the care that they need. Too many people who may have insurance and access but are not receiving the quality of care that they deserve.
And those are our 2012 South Sound Healthcare Champions. We'd especially like to thank Pardaman Productions in Olympia and Sands Costner Associates in Tacoma for sharing those video pieces. Back to you, Jeff.
Thank you, Holly. We at the Business Examiner Media Group thank the thousands of physicians and other medical personnel affiliated with Pierce County Medical Society and the Thurston Mason Medical Society, both of whom have made this program possible. We also want to thank Mobility Media Design and its principal, Richard Aronson, for making video production of this program possible. And great appreciation goes to Puget Sound Energy for its long-term sponsorship of South Sound Business Report. Thank you too for watching. We'll be back again next week at the same time and same channel, and hope you'll join us.